Welcome to Your Health Equity Matters. I'm Elgloria Harrison, the Dean of the School of Health Science, Human Services, and Nursing. And I'm thrilled to launch this podcast where we explore health topics that matter to our community with a special focus on equity. Today, we're diving into the topic of health equity and why this matters to our Black and Brown communities that we serve. Many of us have heard the term health disparities and health equity, but often we don't know what that means and how it really impacts us. Dr. Paula Braveman has done a lot of work in that area and, in fact, published an article in June 2025 that affirms that health disparities, health inequities is not a household term. Most of us don't talk about those issues around the kitchen table. Yet most families who are Black, African Americans, or Hispanic are subject to unequal distribution of health care. Some examples include the difference in maternal child health care between Black women and white women, the difference in diagnostic treatments for prostate cancer between Black and Hispanic men and white men. To help us dive into this topic, I am joined today by Ms. Shirley Torho, a public health practitioner and the CEO of Black Health. Welcome, Ms. Torho, to this first episode of Your Health Equity Matters. Ms. Shirley Torho is a public health strategist with extensive experience advancing equity through programs, research, evaluation, and advocacy. Her work exemplifies leadership at the complex intersection of public health, education, community engagement, and equity. She navigates these overlapping systems with a deep understanding of how structural inequalities affect health outcomes, especially for marginalized populations. Her abilities to lead initiatives that integrate evidence-based practice, community voice, and policy change at both local and national levels reflects a strategy, equity-driven approach that is both innovative and impactful. In 2024, she became the president and CEO of the National Black Leadership Commission on Health, that is Black Health, after years of service as a consultant and board member to the organization. I am so pleased that you are our trusted voice in this community to help us to understand the importance of health disparities and health equity in various conditions that many of us and our residents face every day. Thank you for being a part of this episode. I'm excited to hear your insights, and let us talk about what health equity is. Why don't we start there? What is health equity?
Well, first of all, I'd like to say thank you for having me on this inaugural episode. I'm really, truly honored, especially given our several years of, collaborative partnerships with Lehman College and with you. So thank you. And so diving right in to answer your question about health equity is ensuring that every single person is able to have a fair and just experience, access to health care, right, leading to positive health outcomes for that person. And, another way to think about it is really meeting people where they're at, right? We're all at different levels of education. Maybe our background experiences are different. Our zip codes are obviously different. We live in different neighborhoods. And the ways in which we take in information and experience the world are also different. And so when it comes to healthcare, it's really important to meet people where they're at, ensuring that there is equitable access and treatment of individuals ensures that you're meeting people where they are and providing them with care that speaks to their relevant needs based on their lived experience. So that's really at the fundamental way of looking at health equity or understanding what health equity is. And it's about everyone, right? It's about ensuring that you're meeting everyone where they are, not leaving one group or some groups behind while others move forward.
Right. Well, I'm so glad that you said that because, we oftentimes hear this term health disparities, right? And what is health disparities? And I know that for the most part, health disparities is a measure, right? It's how well we measure, how well we're doing in the healthcare systems and things like that. let's talk about a little bit about what's the difference between disparities and equities and inequities. What does all that mean? Because our audience, we want to educate our audience, right? So we want them to be empowered to understand that when they are accessing the healthcare system and these terms become very relevant, they can empower themselves before they get there to know exactly what they should ask for. So we are really trying to make sure that our audience really advocate for themselves. So let's talk a little bit about what's the difference between
Yeah,
that.
no, that's a great question. I appreciate that. So I would say let's start, you mentioned, in your introduction that we're often talking about the inequitable distribution of resources in our communities, across communities. And so let's start there, right? When resources are distributed in a way that is unfair or is unjust, so let's say we have two communities. One is receiving 10 gold bars. The other is receiving 3 gold bars, right? Fundamentally speaking, especially if there are pretty equal numbers of people in both communities, the community receiving the 10 gold bars is going to fare off better than the community receiving 3 gold bars. And so when we think about the inequitable distribution of resources in our communities or across different communities, there are certain communities that just because of power, because of privilege, because of systemic and structural issues and barriers in our communities, some people just get more than others do, right? Whether that's fair or unjust is a different conversation, but
right.
that's the reality that we live in. And so it's really important that we have those conversations, right? Because at the end of the day, there are communities that just don't have as much as others do. And so that's, that introduces the inequities that we talk about. And so when those inequities exist, essentially there are gaps, right? There are gaps in access to care. There are gaps in, resources in our communities, healthcare centers, clinics, safer sex kits, right? How far is your closest provider to you, right? If we think about living in a metropolitan city like New York City and a rural community upstate somewhere, maybe your closest clinic is 30 miles away. You don't drive a car. You can't afford to, get on public transportation. What does that mean for you? Ultimately, your experience with the healthcare system is going to be very different. And so those sorts of inequities are what introduce the health disparities. The health disparities really are speaking to the health outcomes that result from having these gaps in the ways in which resources are distributed, across communities.
So I'm going to talk about your personal experience with Black Health, because I know Black Health has a lot of opportunities to really educate the community on different types of chronic conditions like breast cancer or prostate cancer, those kinds of things that are pretty prevalent in our community. So let's talk about, when I read about, Dr. Braisman and her work that she's been doing, and I think back about maternal health, maternal child health, and I know that here at Lehman College, there's been conversation about how we can actually educate our nurses or our nursing students to really be more focused on the equity or inequities that many mothers experience when they're delivering children, right? And so there's lots of talk about maternal child health. Let's talk about how that is seen as an inequitable distribution of health care among mothers that are of color.
Yes.
And so let's talk about that.
Yeah, and it's a little bit frustrating to talk about because at this point we've been talking about this for years now, right? Decades even, and we continue to see these gaps. And so when we talk about inequitable distribution of resources in communities, there is obviously a structural piece at play too. And so when I talk about structural, I'm talking about, policies. I'm talking about the ways in which our communities are physically built, right? Urbanism and the built environment. I'm talking about, even down to experiences of discrimination in the healthcare system. All of that contributes to this idea of inequity. And so for women of color, especially Black women, we continue to see that issues like bias are playing a huge role where individuals are not being heard. Women are showing up in hospitals in labor and are being turned away, right? This is something that happened with a few days ago. It's been all over the news and all over social media. Women are complaining about pain. They're complaining about, different things happening, physiological and, mentally, and are literally just not being heard, right? And so at some point, when we think about what inequity looks like, yes, there's a piece about what are the resources, right? Do people have access to, quality health care? Do people have health insurance? Do people feel comfortable even talking to their providers? But then there's also this piece of, well, once all of those things are in place and I do have good care, I do have good health insurance, I'm articulate and I can have these really engaging conversations with my provider. What then, right? And we're still seeing that even when all of those things are in place, Black women are still having negative experiences with providers. They're still dying at higher rates during childbirth. Their children aren't faring off as well as, white kids do. And Black women are dying anywhere from 3 to 8 times more than white women are during childbirth. That's something to look at. And again, bias is part of it. Discrimination is part of it. And, while I think that we as communities have to really advocate and empower Black women to be able to, express their needs and also educate them and be able to provide them with resources to help navigate systems so they can, have access to better care, there's a piece around, what are we doing with our providers, right? What kinds of provider trainings are being offered around issues like implicit bias, right? Implicit bias. Because that we're seeing that does actually play a huge role across all health disparities, but especially when it comes to maternal and child health. And we've even heard from prominent figures like Serena Williams, right? Who
absolutely.
was complaining about,
Beyonce,
right? We hear, so this isn't anything new. I mean, at this point, it's dinner time conversation for women, right? That the impact that this topic is having. And these things impact your quality of life, right? It's not just a momentary thing. This is something that follows you. It's a stressor. It's a form of trauma that has long-lasting impacts. And so when we think about the ways in which our communities are able to thrive and, succeed and, gather the resources they need to live a quality life and have positive experiences, not just with health outcomes, all of these things play a role.
Right. So we've been talking about, maternal child health, but, we can actually extend that to breast cancer. We can extend that to prostate cancer. We recognize that, most Black women don't get screened or their mammograms checked as often as they should because, either they don't have the insurance to be able to do that. So those still constitute that health inequity. And some of it is because perhaps, just like you just mentioned, not enough resources to be able to allow them to actually understand that. I personally think if we were able to empower more women to understand why this is necessary, because we as Black women should not die from things like that could have been prevented, that could have been prevented. I even think about, prostate cancer. And actually, I've been doing some research recently on prostate cancer, particularly in Black and Hispanic men or men of African heritage or Hispanic ancestry. And I began to realize how important it is to destigmatize this whole notion of you should be screened. A lot of it has a lot to do with the type of testing that happens with Black men or Hispanic men, and this whole notion of being, what do I want to call, macho.
Feeling violated.
And feeling violated that they have, that these are the tests that they have to have. But how so important it is for them to actually be screened. So let's talk about what could we tell our audience that they should be doing so that we can really empower our communities to be able to take more of an advocacy role on themselves so that we can somehow dig ourselves out of this kind of muck and miry that we don't know. We do know, and we want to make sure that that everybody that needs to have a screening, needs to have some type of education, get that education. So what do we think? What do you think would be a good thing?
Yeah, so to your point, we do know, right? And many of these diseases that our communities are experiencing, at a burden, are preventable. And so I always say that stigma is increasingly playing a role in all of these health disparities. When Black Health was originally founded as the National Black Leadership Commission on AIDS in 1987, the topic we were dealing with was HIV, right? And HIV still carries a lot of stigma with it. Yesterday was World AIDS Day, right? But one of the ways we combat stigma is by talking about it. Have conversations with your family members, have conversations with your friends, talk about it the way you talk about something on social media, because when you create communities where you can have conversations, you're able to address facts, you're able to address myths, address misconceptions, and learning becomes communal. Learning becomes fun, and, as a group, you're able to dig through some of these things. So, those conversations really, I think, serve a dual purpose. One being they're educational, and you're arming yourself with information and potentially equipping yourself with the tools and the skill set you need to be able to navigate some of these things. The second piece being you're able to, demystify some of these topics and, destigmatize them too, knowing that other people in your world, other people in your circles are also experiencing these things. I would also say that, it would be unfair of me not to address the fact that members of our community, Black and Brown, still deal with a lot of mistrust of systems, mistrust of governments, mistrust of the healthcare system. And while that's warranted, I do think that this is where, these sorts of smaller group one-on-one conversations can come in. I think that, as healthcare providers, whether we're in public health, whether we are physicians or otherwise, we really have to, look people in their face and admit our shortcomings as a healthcare system and just say, these are the ways that in which we understand that your communities or our communities have been harmed and wronged. And here is how we're doing things differently, right? What does accountability and transparency look like for our healthcare system? And, those are honest conversations that I do think we need to have. And, it's important that we don't have them in silos. We ought to bring community members
together
in to have those conversations because there's some real trauma that folks are living with. And sometimes people are living vicariously, they're experiencing secondhand trauma, vicarious trauma, because of some of these experiences, right? And these weren't experiences that happened 40, 50, 60 years ago. Some of these experiences are happening right now in our health facilities every single day. We saw a lot of it during COVID-19. And so it's commonplace, and we just have to have real conversations about it. So the mistrust piece is really important. And one way we address that at Black Health is we actually leverage the support of community outreach workers and peer workers, peer educators, because they really are the credible messengers in our community, right? They're the eyes and ears. And again, it's about meeting people where they are. And so if we're working in, a housing development, for example, there's somebody there who has a lived experience who we can talk to and, have them essentially go around and say, hey, this is what my experience has been. How can I help navigate you through the system, right? What resources can I personally and as an organization provide you to help navigate these systems? So all of these, I think, while they feel like pretty small steps to take, can have really significant impacts, across health disparities, right? These are strategies that, work across the board. So I would certainly start in these places.
Absolutely. And so you just said something about the actions that folks can take. And just as small as just talking to someone about, hey, have you experienced this before? Because that helps to kind of build that trust that people can. And I also want to say that, when you are going into the healthcare facilities, go in with knowledge. A lot of times when we go in, we believe that our healthcare provider is just going to tell us everything that needs to happen, and we just sit up on the side very passively and not engage in those conversations because we have this either we trust or we have this, well, the doctor knows kind of a scenario. And even the doctors really want you to come in
Agreed.
with some, understanding of your condition so that you can have an intelligent conversation about that. So what we want to say to our audience here is that we really want you to, when you are engaging in the healthcare environment, make sure that you ask the right questions.
Absolutely.
You come prepared. And I always say you come right with those questions written, because when you write them down, you actually are able to really be able to articulate them when you get into that doctor's office and really have your questions answered. But you also mentioned about, it can be a kitchen table issue. We could actually sit around and talk to our families. This is the one thing about the African American community. We actually are very steep, and of course the Hispanic community as well, very close ties with families. And so if there is an opportunity to be able to share from generations to generation, that's where we break the myth of the trauma that has happened in the past and how we can actually overcome some of those kinds of things. So let's talk about the last thing we want to do is to really remind our audience right now what kind of steps we can take really to be able to kind of empower ourselves to do this work.
Well, I appreciate what you're saying about the collective action piece, right? It really does take a village, and it sounds so cliche to say, but communities save lives, right? And, one of the things that always resonates with me when it comes to the work that I've been doing for over 20 years at this point is that communities really have been at the forefront of mobilization, right? Grassroots movements, community-based organizations, community-centered, movements are really what help to create the level of advocacy that we need to affect policy change in our communities. And so definitely talk to people. But I would also say, don't be afraid to ask questions, right? You brought that up, not just with your providers. I think that sometimes people are hesitant because they think, oh, that's a silly question, I should know. But, don't make assumptions about what you should know, what other people know. There's nothing like a teachable moment, when it can actually change the course of your life. And so ask questions, ask uncomfortable questions, right? Because better safe than sorry, right?
Absolutely.
Better to get the answer that you're looking for than to assume that it's a silly question and not ask it at all. Absolutely. I would also say that I know more and more our attention spans are pretty much non-existent.
Absolutely.
But I'm a true believer in the consumption of information. Google exists for a reason.
Exactly.
AI exists, right? Like we all have different levels of comfort and even just like appreciation for some of these tools, but information exists for a reason, right? Like Google something, and again, I know that there are lots of people, myself included, who will jump on Google when I have symptoms and try to diagnose myself. I'm not saying that go do that. I don't think it's wise to do that, but I do think that it's important to at least consume information about the things that you want to learn more about, right? The resources are out there, and it's important that we use those resources to the best of our abilities, but also as tools to empower us.
And just what you said, we want to become one of those trusted voices out there so that when you come back to our podcast, we will actually be able to provide you information that you can actually trust. The whole goal for this, for our providing this kind of information is so that you have another tool, another opportunity to be able to get information that is reliable, that's credible, and that you can then take to your provider and say, I did understand this, but I don't understand that. And so that is the whole message here. So I want to stress enough the importance of achieving health equity in our communities. Having knowledge about what health inequities can empower us to advocate for ourselves, for our families, for our communities. Learning to advocate for yourself assures you can help your families live healthy lives from here on out. I want to thank you, Shirley, for coming on this podcast and for sharing your insights. Thank you for joining me for launching this insight. I'm hoping to be able to ask you to come back at some point in the future. Your health equity matters. Until next time, we'll explore RSV, influenza, asthma, and vaccination because that's a big topic
That's
as
a huge
well.
topic. We actually just did a series on
Right.
that.
These are tools in your prevention toolkit so that
Absolutely.
people can actually protect themselves. Remember, if you have a question or we didn't hit on something that you were wondering about, go ahead and drop it in the comments. We love hearing from you. Don't forget, small steps can make a big difference. Till then, stay healthy, stay informed, and we'll see you next time.